I'm Kevin Benson. I'm a urogynecologist with Sanford Health in the Department of Female Pelvic Medicine and Reconstructive Surgery. I'm the department chair at Sanford Health. Women who suffer from stress incontinence, unfortunately, they suffer too long. It interferes as a young, active person in what you want to do. It creates embarrassment, it creates social isolationism, etc. So for me, any woman dealing with this that's impairing their life and creating a problem, it's time to get it better. So for all those reasons, treating this problem for me is really an important topic and something I'm passionate about. In identifying patients that may be eligible for surgical correction of stress incontinence, I think it's about having an algorithm. It's about having a process. It's about treating all patients in a uniform manner so you can evaluate them consistently. I think one of the other things that I think is really important in your algorithm is to determine what goals are. And so beyond just obtaining what the history is that brings them to your point, make sure that the goals that you can achieve with what you do are consistent and compatible with what they want. In describing Solyx to my patients, it's in relation to all of their options. And I think that for me, it's about describing the entire problem and then offering that as an option within the problem evaluation. So when I discuss Solyx, I'm an advocate for it. I'm really discussing for them what I think are the attributes that set it apart from other slings. So my discussion really goes into the history of slings, talking about what we did before slings, talking about alternatives to slings, and then within slings, talking about the generations and the development, and really what led to where we are today. And I think that gives patients a roadmap for how it is separate and works differently than other associated slings. And so for patients, it allows them to make, I think, a really clear decision on what they're looking for and why this is different. When I look at Solyx and what differentiates it from the other slings and what its attributes are, it really, for me, gets into a discussion beyond the procedure itself. I think that any procedure that we do to treat this should be effective, it should be consistent, it should be reproducible. And Solyx has all of those things. I really started educating patients about Solyx slings by going back to the basics. Again, talking to them about the pathophysiology, why stress incontinence occurs. Why are you in my office today? What were your risk factors that put you here? And the second thing I talk about is, how common this disorder is so that people understand that it's not as isolating, that there's other people with this, and that this algorithm, this plan has been figured out. And when I educate patients beyond that, we then use models, pictures, etc. I like to draw a lot, so I draw patients' pictures. I actually keep the Solyx Sling in my office, and I actually let patients hold it. I let them pull on it. I have models of how Solyx is placed, where it's placed, the introducer, everything. One of the most rewarding parts of my practice is to see patients after they've had a Solyx Sling. I'll give you an example. I have a patient training for the American Ninja Show. And before she had the Solyx Sling, she would wear 4 or 5 pads, would have to cut her workout short. A week afterwards, she was back doing her workout and actually made a little video for us and explained that she didn't have to wear pads anymore. One of the things I've really learned about medical education is it's individualized, right? And one of the things that I really like about Boston Scientific is they offer a lot of opportunities to learn in different ways. And I think support, the support that they have for you as you go through this journey is awesome. So the ability to learn in the way that you have to and to get the support that you need, for instance, with didactic learning, with cadaver courses, with physician proctorship, with being able to get on the phone with an expert and discuss a case, to have people who can mentor you in presence or virtually, and then your ability to follow up with them and their support to really drive your ability to do better is really so critical. And you're really supported every step of the way through Boston Scientific. And I have really benefited from it personally as well as the physicians that I've trained. My biggest word of advice for physicians learning Solyx and utilizing it is stick with it. Really learn about the therapy, learn about the advantages it has, and then really for yourself, find a way to get support so that you can learn how to do this. When I utilize data to try to determine what clinical choices I'm going to make, I always think of data as a point of information that you need. So in this particular situation, what I'm comparing to is the generations of slings before. So I want a product that would be as efficacious. I want a product that's going to be as safe. And I want a product that's got data to really show that over time it works. So when I look at data as it relates to single-incision slings and Solyx, I really feel that we're there. My take-home message for physicians and for patients with Solyx is it's a different game. And what I mean by that is it can be a completely different experience. And we need to get out of the paradigm of all of the reasons why patients should not do something. And we need to get past those barriers to where patients do something and get treatment that works, that's effective, that doesn't disrupt their life. And the number one thing patients say to me is, why didn't I do this 5 years ago? And every time I hear that, I think we've missed an opportunity, because that means 5 years they were not doing what they wanted to do. They were pulling themselves back in any number of ways. The Solyx Sling has brought me more joy and has brought my patients more joy than just about anything I do. And it's rare that one can say that.